So I've logged into the system this morning. I'm just on my dashboard screen, and the tab that we are going to look at is going to be the Compliance tab. Okay, now we talked earlier this week on Tuesday, if any of you were in the webinar Tuesday, we talked about care validation, and that was actually kind of reviewing those visit notes and things like that after they had been passed, or I'm sorry, after they had been completed, but before they actually passed and became a part of that patient's medical record. The next tab that we have here underneath care validation is the Audits tab. Now this is the tab that you guys are going to utilize to kind of go in and review everything after it's all been finished. So this is kind of after the fact. It allows you to go in and review this information. You'll notice when I click on that Audit tab, it takes me into my main audit menu. I have my search criteria at the very bottom of the screen. The system is trying to actually default to the last patient that I was working with, but I can easily click on that red X to erase that patient filter, click on Search to refilter that list, and this is going to show me all of my different patients, maybe referrals, that I have in the system. It'll show me the patient or referral's name over to the left-hand side, also with a dash and their MR number. If they are admitted or an active patient, you'll be able to easily see that admit date here in the admit column. If they're a discharged patient, you'll be able to see that discharge date in the DC column. You have a status column to, again, just help tell you what status that particular patient or referral is in. As you can see, I have quite a few referrals that are showing up here at the top of my screen. As I scroll down, I see some patients that may be on hold. My active patients start showing up. Here's one that's actually been discharged. And then over to the right-hand side, you have your audited column. Now this is just going to give you kind of a quick view and let you know whether or not that particular record has been audited. Okay, so I see a Y here in this audited column, so I know that I've actually clicked into this particular patient and I've either started an audit or I've finished an audit. All of the N's mean that no audit has taken place. Now there's a little bit of initial setup that you guys need to do before you can actually start using this audit system. You do have some other options over to the right hand side, and the first thing that we're going to want to do is set up our audit questions. We can't actually audit a patient's record or a referral's record without having some questions that we need to actually answer as we're going through and doing that audit. So once I'm in this audit menu, I'm going to move over or move my mouse over to this underlined Audit Questions under Other Options and click on it. And that's going to take me into a list of all of my compliance audit questions. Now I don't believe that we actually default these questions into your database. We do have kind of a master list of questions that you guys can look through. If you would like to use some of those, we can default those into your database for you. I will actually post that Excel file or that file when we post this training video in the alert later today. That way you guys have access to that and you can contact the training department directly in order to get those imported into your database. Otherwise, if you'd like to customize or add in your own audit questions, which is normally the most common ones or the most common way that it's done, you'll want to look at your other options that you have available on this page. Now you have quite a few different other options. Your reports will just take you into the Report Center in HealthTrust software, so you can run different types of reports related to these particular compliance audits. You also have the Compliance Audit Menu option, which will just take you back to that first page that we saw where you can view a list of all of those referrals or patients that you actually can audit. You have your question templates option as well under this other options, and this is something we're going to look at after we actually set up our different questions that we want to add in. And then you have your add question option. Now this add question option is going to be the first one that we look at. So I'm going to click on add question, and that's going to open up an add question field. Okay. Let me see. It's telling me I may be experiencing some low audio quality, so I don't have any additional windows open. If any of you are having trouble hearing me, send me over a question or basically a message, and I'll try and see if we can't get the audio issue resolved if any of you are having trouble hearing me. But once we get into this add question screen, this is going to allow you guys to set up the different questions that you would like to use when you're actually auditing any of those medical records or any of those records in that compliance audit screen. Now you can add in different templates so you can group the questions together by maybe a specific section that you'll be auditing. We'll look at that a little bit when we talk about setting up question templates. But for right now, let's look at this add question page. Okay, the very first option that we have here on this question page is going to be a question box. This just simply allows us to type in whatever question it is that we would want to ask or answer when we're going through that actual audit. Okay, so if you were wanting to ask, maybe does the patient have a particular document in their medical record? Was the initial paperwork that they signed when they originally came on with your agency, has that been scanned in and uploaded into their patient profile? You know, was the start of care visit done within 48 hours of the referral? Different questions like that that you would actually be looking for as you're going through those records. Now once we actually get into the auditing, you'll notice that we have different sections that it kind of groups that record into. Okay. The different sections when you're setting up questions are listed here. So for example, if it's something that is related to maybe that patient information, maybe you want to make sure that the eligibility was checked before any billing was done, that would be something that you could list in the patient tab, because you would actually go into the patient menu to look and verify that eligibility date or that date eligibility verified. You have an episode option too. Maybe you want to verify that a first billable date has been entered, or that the correct episode status is in there, or just verify that you know, the episode status is correct or episode dates are correct. You have a charges section, so if it's something related to a specific visit or service that was done, you can choose charges. The plan of care is going to allow you guys to view that plan of care and maybe ask any audit questions related to the plan of care. Same thing with physician's orders, communication notes, and then you also have billing. So just choose the most appropriate section that that question needs to be assigned to. You have different subcategories that are also available in there. These are just different categories that you at your agency actually assign. So you guys would customize kind of this subcategory. We'll look at how that comes into play when we're auditing and we're actually looking at that patient record, so it's a little bit easier to see what it does. And then just below that you have your priority box and your value. The priority box is going to allow you to set a specific priority for that. If we have any nursing agencies listening right now, it's similar to the way your RN assigns a priority on the instructions when they're doing that plan of care. This priority box is just going to be a numerical field that allows the system, based on this number, allows the system to kind of realign those questions and order them based off of that priority. You also have a value box just underneath priority. Now this allows you to assign each question a different value. So if it's a higher priority question, it may also have a higher value in the scheme of things. Some of the different reports that we have in the system will basically apply different percentages and give you different values based on this particular box here, this particular value box. That way you can weight your questions a little bit differently so that if this is a higher priority question and it's worth more or it's weighted a little bit more because it's a very important question you guys would use or check for when you're auditing, that way when they answer that question as yes, it would basically apply more points or a higher percentage to that overall compliance score. Or, if they answer no to that question, it would obviously weight it a little bit more to where it takes off more points or more value so that it would in turn give you a lower compliance score when you're actually checking that score through our report center. Okay. The next field that we have just below that is going to be our help text field. Now what this field allows you to do is enter in any helpful information, maybe what you're specifically looking for in this question. If the question itself isn't self-explanatory, it may be a section of the system that they need to specifically go to and actually look. It's an optional field. You don't have to fill it out. Just like our question box at the very top, it is an unlimited text box. So you can type as much or as little as you need to. If you selected section as charges, you have the option down here to actually limit that particular question to a specific type of visit or a specific type of service code. Now you don't want to use this option right here if you have it set to anything other than charges. This is only going to be useful if you have charges listed as the section. Use your magnifying glass to actually pull up a list of all of the different services that you have. Maybe it's a question about the Oasis visit, or maybe it's a question about an admission visit. Scroll through, find that visit, and then just simply click on it to insert it into that field. The red X next to it just allows you to erase that field. And my computer's running a little bit slow this morning, so it's taking a few minutes for it to refresh the screen. And you also have your status option down here at the very bottom, either active or inactive, and then a notes bottom that's just a notes section at the bottom that's just strictly used for internal purposes only. Any internal notes that maybe you would need to add in here about this question. Again, if it's something regarding how to answer that question or maybe what specifically you're looking for, I would add that in this help text field. Click Submit to save this question, and that's going to take you back out to your compliance audit question screen. It'll add that question to the list, and then you can just continue to click on Add Question to set up those different questions that you'd like to use. If you wanted to edit or review any of these questions here that you've already added in, just click on that underlined area and that'll take you into the Edit Question screen. You'll notice that we have the same fields that we actually saw in the Add Questions screen. And then just click Submit if you made any changes to actually apply those changes to that question. Now, after you've gone through and set up all of your different audit questions, you'll want to go in and also set up question templates. Now, question templates are going to be used to kind of group together your questions in a certain order, okay? So on this Compliance Audit Questions page, I'm going to scroll down to my Other Options section, and I'm going to click on Question Templates. And that's going to open up my Questions for Template option. Okay. Now sometimes this page can be a little confusing for people, so let's talk about the two different options that we see here. We have the option of adding in a new template, which is over to the left-hand side. You just type in the name of the template and then click Add. And then you have the option to the right-hand side to edit an existing template. So if you wanted to edit an existing template, use the drop-down box to find the template that you want to edit. And then once you've found it, click Select, and that will actually load all of those questions that you have in the system that you basically can choose from to go on that particular audit template or question template. Now, all of the questions that are checked are the ones that are going to be included on this particular template. Anything that isn't checked will not be included, so you don't have to worry about it showing up. And then keep in mind, you also selected a specific section for each particular question. So not only is this grouping them together, so let's say we're using this training template here, or actually let me choose charges and see what questions I have here. Okay, so let's say we're choosing the charges template here. So this is a template that basically we're using maybe for different areas of the system. As you can see, I have our Applies To column here that's telling me that these questions are actually applied to that charges section, or basically when I'm auditing those visits. So if I select this template when I'm auditing those visits, I'll only see these questions that are linked to that particular charges section of the system. Okay, let's say I also selected maybe an aid supervision performed question. Maybe I'm also choosing OASIS POC completed. These are questions that may also relate to an actual charge or something that I may need to edit related to a charge. But as you can see, I actually have it linked to the episode section here because I would need to check that within that episode option. Or again, down here in the patient, I may have it linked to different sections. Okay, so each section that you're in, once you actually get into the auditing, even if you're using one template, you may see different questions that appear from that template depending on the section that you're in. And hopefully that makes sense to you guys and I didn't confuse you. It can be a little confusing sometime, but once we actually go in and start auditing, I think you guys will see kind of how it comes into play. If you've made any changes, just click Submit to save. It'll ask you if you're sure you want to add these questions to the template. You say OK, and then it'll refresh the screen for you. Now, if you needed to add in a new template, just type in the new template name, select Add, and that's going to load all of the questions that you have in your question database. And what you can do is you can scroll through and you can just check off the different questions that you want. Okay, I'm just going to select a few. Now these probably aren't questions that I would want in this particular billing audit, but just as an example, I'm going to select a few. Click Submit once you're done selecting those questions, and that'll again refresh your screen and allow you to start over. Now if you were to go over here to your Edit Existing Template, we can see here's that billing audit template that I just added into the system. Once you're finished setting up those question templates, close that window. You'll be back on your compliance audit questions screen. And what we want to do now is we want to start utilizing that audit section. Okay, so we want to go back to the compliance audit menu, or that main menu that we had seen when we first went to the compliance and audits section. Okay, now you can choose compliance and audits to go directly back to that audit menu, or while you're still on the audit question page, you have a compliance audit menu option over here under other options. Clicking on that is just going to take you right into the main audit menu. Now again, if it's defaulting to the last patient that you were working with, you can click on that red X to erase that patient's name, and then click on search, and that'll reload the page with all of the patients and referrals that you have available. As you're looking in this list, you'll notice that several fields are actually underlined. If you click on that admit date, that actually takes you into the patient menu where you can scroll through that patient or that referral's information. You also have different patients here that have their name underlined. So as you're scrolling through this list, once you've found that patient that you'd like to audit, click on their name, and that's going to open up our compliance audit window. Okay. On this page, you'll have some basic information like your patient's name and their MR number. You'll also have a list of the different episodes and the status that they're in. And then you'll also be able to see a list of all of the charges or all of the visits that are on that particular patient's schedule. Now, as you can see, there's a status over here on the right-hand side, so they may not be visits that have already been completed. They could be visits that are still in a scheduled status, or they could be visits that are already completed or maybe waiting to pass that care validation process. So scroll through this page. We're just going to start at the top with our patient audit. Now our patient audit, when we click on this audit button, that's going to open up a new compliance audit screen where we're just auditing that patient information. Okay, you have your list here of all of your different questions. Now it defaults to your question template as default, but you can use that drop-down box to actually select the template that you'd like to use. So if we're auditing the patient menu, maybe I want to use my training template that I had set up earlier. Once I select my template, I'm going to click on Go, and that's going to load those questions that actually are linked to that patient section. Okay, so where we had listed that section a little bit earlier as patient, that's what's pulling these questions here from that training template that are linked to that particular section of that profile or of that medical record. Okay, we have our questions here. You'll notice that if I click on this question, that actually brings up any help text that may have been added in. Or I also can click on the right-hand side. There's a little H. When I hover my mouse over it, it says help. I can click on that to also see that help text. Now if I wanted to also add in some additional information or some additional help text for the next person that's auditing, I can just click on Edit, add in whatever I need to, and then click on Submit to save that information. Close the window whenever you're finished. Now, if you wanted to actually look and go into that patient's medical record so that you can answer these questions, let's see. Here, the first one says face-to-face encounter form received timely. So if we wanted to actually go into that medical record for this particular patient and check to see when that encounter form was received, we can click on this View Record button, at the top of our page, and that's going to actually take us into that Edit Patient screen, or that patient menu. Okay. What we're going to do once our tabs load is we're going to look for that area. Since our question was about the face-to-face encounter form, we're going to look for that area that face-to-face encounter form was entered. Now, this particular patient doesn't have any face-to-face encounter information entered, so if I wanted to, I could click on this X. I could answer the question as no, and then I can click on Save Answers to actually save my answer. Okay. Over to the right-hand side, you'll notice that my C is now underlined if I've actually answered that question, and I can click on it and add in a comment. So maybe my comment was face-to-face encounter form was not added into the system when the referral came in or when the encounter was done. Maybe my solution is something that my intake person needs to do, or some sort of steps that maybe need to be taken to resolve that issue, or to ensure that that information is actually getting done in a timely manner, and also getting done, period, since I see that this patient actually didn't have anything entered. Okay. Up at the very top, before you save your comment, you can also assign it a severity. So depending on how big of a mistake it was, or depending on the severity of the actual issue, choose that using the drop-down box, and then click Submit to save your comment. Okay, that's going to save your information for you. You can see up here it says Answers Saved Successfully, so you can just close this window once you're finished and then move on to the next question. Now, you don't have to click on Save Answers every time you answer a question. If you'd like to answer all your questions first, click on Save Answers and then actually go in and add your comments. That will work as well. Just make sure that before you finish this page, you always click on Save Answers. That way, when you close the screen to go back, maybe audit another section, it saves all of the information that you've entered. Your next section that you have is going to be your episodes section. Now, you have an audit button that's located next to each episode. Clicking on this particular audit button is going to take you into a compliance audit screen where you could actually view the record. Again, select your question template that you want. And let me see if I have any questions in my training template for this episode section. I do have a few. Again, if you want to actually view that record, click on View Record. That'll take you into your Edit Episode screen so that you can verify maybe the type of the episode, or that first billable, or episode timing. Now, when your question templates actually load, you'll see here that we have our title of our page, or this section, is labeled as question. And you remember when we were adding in those different questions, we actually had that box that was titled Subcategory. Okay. This is how you guys can see that subcategory in action. So we listed the question here, and then for the subcategory, we listed medications. And so as you can see, it's kind of separated them based on those subcategories that we had entered. And then again, you answer the questions the same way. You have your help option, and then again, you can't click on your comment option to add in your comments until you actually answer that question and save that answer. Okay. Once you're finished, close that window, and then the last section that we have on here is actually our charges section. Okay. Now, you may be wondering why we don't have it broken down a little bit further. Okay, and the reason why is because you actually can access pretty much all of the different sections in the system from this one screen. Okay, so for example, when I click on the audit button for the patient section and I click on view record, that takes me into the patient menu. So I can also click on the insurance tab to verify insurance information. I could also even look at the episode tab to view that same episode information that I can see when I go into the episode section. I can also click on e-records to view any scanned-in documents, any diagnosis and procedures from that plan of care, medications, referral information, face-to-face information. And then the same thing kind of goes for this episode section. When I click on audit and then I click on view record, I can view not only this episode information, but I can click on my interventions button and I can view maybe existing wound care orders, or I can view interventions. Now the add options are actually options that we would use in another part of the system, so I would recommend always using this edit option. That way it's just simply going to give you a list of all of those interventions or all of those wound care orders that that particular patient has within that episode or within their medical record. Okay, so I'm just going to close all of these additional windows that I opened up, and I'm back here to my main compliance audit page for this patient, Jamie Adams. Now the last audit button we haven't looked at is the charges button. Again, clicking on this will open up that question template. You can choose a different template that you want, and then you can also choose view record, which is going to actually open up the visit note for that particular document. Now if you'd like to actually see that edit charge screen, or that screen that you normally would see if you were to click on a visit on the schedule, you can access that from this patient section. Okay, so I'm going to click on audit. I'm going to select view record. Okay, and once my tabs load, I'm going to select episode, and then I have a schedule, underlined schedule link right next to each of these episodes, and I can click on that to actually go in to that schedule. Okay, if I wanted to view one of these visits, I could just click on it, and that'll give me access to the different tracking pages. So if I wanted to verify the supplies or the tracking information, like the making sure that it was passed or completed by a certain date, this will allow me to look at those. Maybe I want to look at the billing tab for billing reasons, payroll, and then I can just close those windows whenever I'm finished. So as you can see, you can really access a lot of different pages in the system just from this patient audit alone. But we do have some different sections also here for you guys to utilize with that audit button. Okay, now once you're finished, you'll notice that there's no submit button on this page. Okay, so as you're going through your audit, make sure that you're clicking on that Save Answers button. That's saving your answers, and then that way when you come back out to this compliance audit screen for your particular patient or referral, you can just actually click on the red X to close that window and then scroll through your list and select your next patient or your next record that you'd like to audit. Okay, let me see. I have a question here. It looks like there is a considerable delay in the video, probably about 20 to 30 seconds. I'm not sure if that's the internet on my end that's having some trouble. So I will check the video as we finish. I'll try and slow down a little bit for the last report part. But I apologize, I'm just now seeing that note there. I'll check the video before we post it, and make sure that the video is okay, and then that way if you guys need to, you can go back and watch the video and get that information. Okay, I also have some step-by-step instructions on using this auditing tool, and so I'll also post those with the video and also a list of all of those questions that we could potentially import into your database if you were interested in utilizing our default questions. Okay. The last option that we were actually going to look at this morning is going to be our reports that we have that we can pull from this audit section. So when I click on this reports link under other options, that's going to take me into my report center, and it's going to group it together by the auditing type. Okay, so it's only pulling my different auditing reports that I have. I'm going to choose all answers and run it wide open just so you guys can see what it will give you. So I'm going to click submit at the bottom. Now on this screen, the very first column, as you can see, is provider. You also have that patient's last name and first name, the episode date, episode start date, the date of service, the type of service that was done, and the actual service description. You can see the question that was asked, what the answer was, what section that applies to, and then also the actual section of the system, any notes that you've added in, and the solution, and then the severity of that issue. Okay. Closing that window, going back to my report center. I'm scrolling back up to the top now, and I'm going to choose my next report, which is compliance score. Now this doesn't have very many options that show up here, but if I scroll down and click submit just so you guys can actually see that information, you'll notice this is just giving me my compliance score. So based on those different values that we added in for the questions, the system has automatically calculated the total number of points. It then tells us the number of points that we've actually earned. And then it tells us our weighted score, again based on those different value ranges that we entered in when we were setting up those questions. Now you can filter this particular report by different patients if you wanted to run this to see a particular patient or maybe a particular branch location. You want to see kind of what their total score is or their weighted score is. And then the last report that we're going to look at is going to be our question list. And it looks like the delay in the video caught up, so that's good to know. Hopefully it won't affect the video when you guys are watching the video if you had someone that couldn't make it this morning. But our next report, or last report that we're going to look at, is going to be question list. Okay, the question list report, you'll notice we hardly have any filter options here. And what this is useful for is basically to run a list of all of the questions that you have in your database. You can view any help text. You can view kind of the overall value and priority, the section, and kind of what specific section of the system it applies to. Okay, this will just allow you to kind of go through and make sure that as you're setting up all of these questions, you've entered in all of that information that you're wanting. Okay, click on that list once you want to close that report. And again, those are all of the different reports that you actually have available for that auditing section. If you need additional help setting this up, we can do some additional webinar training on an individual basis So just let our training department know. Again, be keeping an eye out for our alert later today that'll have this actual video as well as step-by-step instructions on how to use the auditing tool in our system, and also a list of questions in case your agency was interested in using some of our default questions. Thanks for y'all's time this morning, and we will talk to you next time.